Good evening and welcome to Talking Teeth Thursday. Wow, 75 years of the National Health Service. That's a big milestone by anybody's measurements, isn't it? You know, if I make it to 75, I'm going to be very impressed. But funny enough, welcome if you haven't been here before. Better really welcome you all. If you haven't been to Grown Smiles before, Talking Teeth Thursday, we do it every Thursday and we talk about teeth. If you've got a question, we're here to help you. And the whole purpose of Grown Smiles is to help you help yourself have a healthier smile for life. But we tend to have a topic. It sometimes can be related to something in the news. It can be something totally random. It can be something that somebody has asked me to do a bit of homework on and talk about. So it can be pretty much anything. So if you have a question, please let us know, because ultimately we're here to help you. So this evening, the National Health Service. Let's talk about the National Health Service. And what I want to do is just let me share my screen, because you really don't need to see my face. Let me get this out of the way and we will be in full swing. Right, there we go. Now, all being well, you should be seeing my picture of jigsaw puzzle, which is basically a reflection of the screen that we had for the post yesterday to basically warn you what we were on about this evening. So let's talk about how the NHS has changed. I think you can think about oral health having changed. Because, you know, 75 years ago, when the inception of the National Health Service, I mean, the whole thing about dentistry is that people were going to be able to get free dentures and replacement of teeth. Now, that had its benefits, because there's a lot of people that had better function, they better aesthetics, they were able to speak more clearly. Have teeth, you know, we need them to eat, we need them to look well, and we need them to actually speak. So really important oral health, and very much it was good to see, you know, if you think it sort of extrapolate some of my random thoughts out, you know, it was good that the National Health Service did incorporate dental health into that health service, because subliminally it was already recognizing that dental health was important for overall health and well-being. And I think over 75 years, you know, our knowledge base, our skills have improved dramatically. You know, so what we're able to offer people, the way dentists do fillings now is really different. You know, if somebody had said 75 years ago, you literally are going to be able to, you know, do fillings by blasting the tooth with powder and water, for one of a better way of describing it. You're not going to need local anesthetic. You're not going to have to cut it into shape to make sure the material stays in, because it's hard. And you're going to be able to literally bond. You're going to be able to stick a filling into it. I mean, people would have thought we were bonkers, but you know, the mechanics, the materials have made huge inroads into how dentistry is provided. But the modern dental team is probably one of the things that has subtly evolved over the years. So we've come a long way from dental dressers, which was sort of where dentists came in, where dentistry was done like a lot of medicine at a time by other members of the community, including butchers, which is slightly scary in its whole concept. But, you know, let's talk about the modern dental team. And what do you actually know about them? Now, Rishi Sunak, Prime Minister, made a bit of a blunder at the end of last week when he was launching, and I'm going to talk about it a little bit more, the new workforce plan for the health service and how it was going to be provided. And he talked about how dentistry was going to be provided. And he could not remember the name of the therapists. So I will explain what a dental therapist is, because there has been so much rubbish on social media basically this week, and there's a lot of the professionals have been trying to actually explain to members of the public and others actually what actually dental therapists are. And I mean, for my sins, there are members of the dental team that do not really understand the roles of each other. And that a lot do, you know, how did they train? Did they train together? You know, when did they train? Where did they train? Were they exposed to working in a team environment? So, a bit like medicine has evolved since the inception of the health service. Medicine has developed into very much a team sport. There was always nurses, but now we have nurse practitioners, the physios. I mean, if you had a bad back, would you really, yes, you might go to the doctor for pain relief, but you would expect to be referred on to a physio. And for that skill for them, because they're experts in their area of medicine. So, the dental team has evolved in the same way. Everybody has their role, and it doesn't make any better. It just makes them different. And when those roles work cohesively, it is unbelievable. And it's all about the patient's experience. It's all about how well your care can be provided. And there's things that some people like doing more than others, and people work to their strengths, and they're trained differently. And, I just thought it was worthwhile taking a look at the dental team, because, we sort of compartmentalize people sometimes, and unless you actually are aware of what all they can do, you may not be maximizing their skill set, either as a professional or as actually somebody who's receiving care. So let's talk about it. So dentistry is so much more than just the dentist. Now, the people I am going to focus on this evening are the people who are actually registered with the General Dental Council. So we have dentists, we have dental nurses, we have dental therapists, we have dental hygienists, with clinical dental technicians, with dental technicians, with orthodontic therapists. All these groups are registered with the General Dental Council. And when the whole team come together with you, and that's why the mouth is in the middle of that image, because that is your mouth, that is the person, that is the patient, and everything has to be patient focused, and it is a team effort which includes you to achieve a common goal. And that's the definition of a team. A team is actually where a group come together with a common goal to achieve. And in dentistry's case, and in dental health and oral health case, it is all about improving oral health, whether that be for an individual, a family, a group in the community, a population. So with dentists and dental teams working in all sorts of areas that come together. But predominantly, we're going to talk about those people that you might come across in general dental practice. So on the high street, or sort of in and around your sort of locale, for want of a better way of describing it. And as I say, you're the key driver of your oral health. You can't sit in the sidelines just by going and ticking the box that you have been to the dentist every 6 months, or you've seen the hygienist every X how many times. That does not guarantee you oral health. The key is very much what you do every single day. So that is something that you've got to consider in that concept of actually looking at where you come in this. Because there's things to do with your lifestyle, there's things to do with your circumstances that influence your oral health. And these are what we call the determinants of health, of oral health. And this is part of a much wider determinants of overall health and well-being, which is, as I always say, there's nothing original in this. This is the researchers that have gone away and gathered the evidence. I'm just presenting it to you. We've got the things that affect your mouth. So your individual behavior, well, probably not rocket science to those of you who've been here before. What do you eat? Do you eat a healthy diet? Do you eat sugars frequently? Do you drink sugars frequently? Do you drink alcohol? Do you smoke or use tobacco products? Or do you vape even? What's your oral hygiene routine? Like, do you make sure you do not go to bed last thing at night without brushing your teeth and making sure fluoride toothpaste left around them? Those are individual behaviors which most of us have at least some control over. What about your dental story? What about your background with dentistry? What's your relationship with dentistry like? Has it been absolutely horrendous? Most people I come in contact with who are really nervous or anxious about going to the dentist, and really find a really tough ask to get into the dental chair. Most of them, it's because of something that's happened previously, often in their childhood. And when, I mean, I always say if you have a good child patient, unless you do something awful, you have got a good patient for life, and it's worth investing, particularly in the time that is required to actually look after small children well. And I have to say, the grandchildren at the dentist today all got clean bill of health. So mum and daddy are going, Nanny will be happy for another wee while. But your dental history, you know, what kind of oral hygiene routine did you have as a child? Did you, your dental routine, were you taken to the dentist? I mean, have you been to the dentist regularly over the years? When was your last dental appointment? You know, what's your family history of disease? You know, so do they have gum disease? Because that's a risk factor for future disease. Was there a lot of decay in the family? Did they have crooked teeth? More likely you're going to have crooked teeth. That all comes into impacting what affects your oral health. You know, did you have a lot of filling? Because the more fillings you have, the more crown and bridge work you have, the more dental treatment you require, sets you up for more. We know people who have had decay in baby teeth are more likely to have decay in second teeth, in their permanent teeth. And all those crowns and implants and dental treatment, all of them are extra little nooks and crannies that we have to try and maintain as we get older. Do you have a denture? Do you have an implant? Do you have a denture? Do you take it out at night? Do you clean it? What do you clean it with? Does it need adjusted? Likewise, appliances, and you know, with retainers and aligners, there's so many more of those around these days, and that has to sort of go into sort of what comes down to your dental history. You know, did you go regularly? Have you been in many years? Do you only go when you've got a problem? You know, how do you feel about dentistry? Do you have missing teeth? Again, because that also not only feeds into your future of dental health, also feeds into overall health and well-being. Some very interesting research in those people who don't do as well if they have lost teeth when they're younger. What's your dental disease experience? Because if you've had, say, gum disease when you're younger, you're going to have to work that much harder. You're going to need more support from your dental team to maintain your oral health and your overall health and well-being. What about your medical history? This is huge these days. We know how much, you know, our medical history and our well-being impacts our general health. No different for your oral health. So, you know, if you have a medical condition, say diabetes, that can complicate increase your risk of, say, gum disease developing. If you have a heart condition or you've had a heart attack, that could complicate providing dental treatment or being able for you to maintain your oral health. Say that you've got motor neuron disease or you have got chronic arthritis. That might have an impact on your ability to clean. If you've got a swallow issue, your swallow threatened, you know, these all have an impact on your overall health as well as your oral health. And you know, your general health is increased risk if you develop dental disease or infection. So that very much comes into, you know, if you have, and people do and have died from a dental infection that has then fed into maybe a cardiac problem or something like that. So, you know, there's lots of things that just all come in to feed into our overall health and well-being. So it's not just about what your dental team can do for you, it's also about what can you do to help yourself. And working together is definitely the best way of actually looking at maintaining your oral health, obtaining and maintaining your oral health. So this is basically some of the people groups of professionals that you may come into contact in the modern 21st century dental team. Now, these are the ones that have to be registered with the General Dental Council. So some of you'll hear about, you know, medical council on the TV if there's been problems, maybe with the General Dental Council holds dental professionals to accountable for their actions. And basically, to practice as a dentist or a dental care professional in the United Kingdom, you have got to be registered with the General Dental Council. If you're not on that register, you're breaking the law. It is as simple as that. It's illegal to practice dentistry until you have actually registered and been issued a General Dental Council registration number. And most dental professionals will have that GDC registration number imprinted on their brain because it's asked for at all sorts of random occasions. Now, to register, it's not just a straightforward thing. I'll ring up and I'll get in the dental register, happy days. You have got to prove that you are who you are, and you've got to prove that you've got the appropriate qualification for the register that you are actually applying to get on to. You cannot register until you cannot practice until that registration number has come through. So sometimes that can be this time of the year. You may well be a student, bless you, waiting for your GDC number to come through so you can take up your first job. And if you're like many dental students I've known over the years, they're champing at the bit at this point because they want to get out of that per student environment, and they want to start earning and they want to start practicing what they've been taught and what they have learned over the years. And particularly because dentistry is a long course. It's one of the longest university courses you can, and it is intense. So, you know, there's a lot to it before they can actually get registered. And once they get registered, that's not even the end of it. Once they get registered, they then have to have professional indemnity, and that's to protect you, the public, in case there is some sort of claim for compensation which they're entitled to. And some dental team members, often dental nurses, in some cases orthodontic therapists and technicians, may have it through their employer. So I mean, it doesn't necessarily a personal thing, but they do have to prove that they do have appropriate indemnity. And when you've ticked all those boxes and got through that sort of registration process and you've proved you've got indemnity, then you have to maintain your skills. So I mean, it's ongoing education. So I used to always, when I did a lot of teaching with undergraduate members of all levels of the dental team, I would say this is your springboard for lifelong learning, because you constantly are evolving. You need to ensure that your knowledge and skills are up to date, and that what care you're providing, you feel confident and competent to practice. And if you don't, you really should not be doing it if you don't neither feel confident or competent and have not been appropriately trained. Now, all this does cost money. So, you know, it's, you know, indemnity, registration, continuing professional development courses and things like that. It all adds to the overheads of being a dental professional. But you know something, for 99% of them, I think they all say it's worth it, although some of you may disagree with me. What you do need to know is that these titles are enshrined in legislation. So these titles are protected by law, and only those people on that specifically register, that specific register, or they're registered, say, as a dental hygienist, can call themselves a dental hygienist. So a dentist who wants to restrict their practice to only doing hygiene type work, they cannot claim to be a dental hygienist unless they have got the qualification and been accepted onto the dental hygienist register. So it's an interesting one, and it's one that sometimes I'm known dentists who have said, oh, I'm just going to do hygiene, but they actually are not a dental hygienist, and it's a different skill set. When they trained, they did some of that, but whereas hygienists spent 2 years or 3 years now purely doing their subset of dentistry, of which their little area of expertise. So, you know, it is one of those things that these terms are protected in law, and we've got to be very mindful of that, and actually think about, you know, how we all work together to provide appropriate support for patients. Now then, these are some of the other people you might come across. And these are also really important. Often they come from a background of some of those other registered professionals. So your reception team often will have maybe started as a dental nurse or has a joint position in dental practice, that they spend some of the time in surgery, spend some of the time in reception. Likewise, a decon nurse, which would be the person who's responsible for decontamination and sterilisation. They have a special room now in dental practices for that purpose of decontamination and sterilisation. They most likely will have come from a dental nurse background. Reception teams, sometimes you have people that purely are reception, so wouldn't necessarily have a dental background, but you know, you spend enough time with dental professionals, you pick stuff up. Treatment care coordinators, again, these are the people that talk you through treatment plans and fees involved. And basically they relieve the dentist of some of the time that it takes to discuss treatment plans and the fees involved. And in some cases, they're incredibly good communicators. They're really good at bringing treatment plans down to a level that you and me, or me in particular, can understand. So it's really important for them to have good communication skills. Likewise, the reception team. Practice manager basically keeps the whole show on the road. Practice managers are priceless, because ultimately dental practices in the UK are small businesses, and those small businesses need to be managed, and they need to be making sure that their profits are outweighing their costs, and that their contracts are for team and everything else are in place. The practice managers are the glue that holds the whole thing together, and make sure everybody knows what everybody else is doing, why, when. Manages surgery time. You maybe have somebody responsible for stock taking and making sure products are where they need to be for certain treatments, for to make sure that if you're having a crown, that your lab work has come back from the laboratory in time before you get the patient. Yeah, these are the people that keep everything else going. But we're going to look a little bit more closely at other members of the dental team, and actually let's have a look at some of them, because some of you might be familiar with, someone might maybe not so much. So who are we going to start with? Oh, sorry. Let me just point out one other thing. Just when we're talking about all the things that these individuals have to be responsible for, the register with the General Dental Council. General Dental Council, as I said, we have to stay up to date. So the dental team must maintain continuing professional development. They usually have a 5-year cycle, and they have to make sure that they know about certain topics as well as the things that they're interested in. So they may decide that they're interested in orthodontics and go and do a short course in orthodontics, or they maybe attend a conference about gum disease or pediatric, about children's dentistry. But there's certain core subjects they need to have been able to show that they have actually undertaken up-to-date training. The top one of those is medical emergencies, and really, really important, because thankfully medical emergencies in the dental setting are not common, but they do happen. And the best way of avoiding it happening to you is to make sure your dental team know your medical history, and that includes all the medications you take, all the supplements you take, if you have been to see your doctor recently, if you have been in hospital, if you're undergoing any investigations, if you smoke, tell them how much. All those things really, really important, because that will help them ensure they manage your care appropriately, that you do not end up in that situation of medical emergency. So things like diabetics. So if your blood sugars are off, let them know. I mean, we have clients that literally are on pumps, on insulin pumps, and they will come in with their phone and they will say, this is what we've got, this is where we are, and I ate half an hour ago and I should be absolutely fine. But it's really important your dental team knows, so they can make sure that they avoid a medical emergency, because the best thing about knowing about medical emergencies is never having to practice anything to do with it. They also got to know about disinfection and decontamination. And just a throwback to COVID, probably one of the safest places to be during COVID was actually in the dental practice, because dentistry's level of infection control was, I would say it was probably the best of all healthcare environments. But if it wasn't the best, it's certainly very close to it, because they were already doing a lot of stuff that then became everyday habit for everybody else, basically. The other thing we've got to keep up to date on, which is highly recommended, how the General Dental Council put it, is radiography and radiation protection. And that's taking x-rays and, making sure they're managing doses, and they make sure that patients are only ever exposed to radiation that is absolutely necessary. And that has to be justified. So really important that those are kept up to date. The other things that they need to, or they're encouraged to, in other words, the General Dental Council recommend, is legal and ethical issues. So again, because law and ethics change. Complaints handling. So you have a problem, your dental team should know how to handle it, and they should have a policy in the practice. Oral cancer, early detection of oral cancer is hugely important. And what you may or may not be conscious of is every time you sit in the dental chair, those clinical dental team members will be checking your soft tissues. They will be looking, and depending on what information you've given to them from a medical history point of view, they may, be looking at you more frequently than others. Safeguarding children and young people and safeguarding vulnerable adults. Again, that is right across healthcare. The dental team actually are looking out and making sure that the most vulnerable young people and adults and children are well protected, because sometimes there's signs of harm coming to children or other people, vulnerable adults, that become obvious in a dental setting where they may not be obvious elsewhere. So safeguarding is really important. So, and it's really important. All professionals need to keep their skills, knowledge, and competence up to date throughout their career. What I didn't say about the medical emergencies in particular, that tends to happen within the dental practice. They do their training regularly, update their skills regularly, and every member of the dental team is involved in that. So who's going to ring for an ambulance? Who's going to get the equipment to, the resuscitation equipment? Who's going to get the oxygen? Who's going to get X, Y, or Z? And it is very much a team approach, that people know where things are, they know what their role is, and that doesn't matter whether you're clinical or non-clinical. Everybody gets involved in that one. So moving on, who have we got next? Oh yes, more regulation. Just if you weren't bored now, this will finish you off. I'm going to have to have my filtering. I've forgotten to put in this slide in. This is all about hoping that you're reassured when you go to dental practice. But dental practices are regulated. So you've got the General Dental Council, who basically register and control, keep an eye on the professionals, the clinicians, and the team themselves. And then you've actually got the environment that is, which includes the individuals as well, but as well as the actual physical environment of the practice. And that's the Care Quality Commission, so CQC. You hear a lot about them in relation to care homes across the UK. In Scotland, it's the Care Inspectorate. In Wales, it's Care Inspectorate Wales. And in Northern Ireland, it's the Regulation and Quality Improvement Authority. And there's nothing will get dental team members' blood pressure up with the thought of an imminent inspection. So they come and they look at absolutely everything. They look at contracts, they look at CPD, they look at the walls, they look at absolutely everything. And everybody does get slightly stressed over it. But it is about the minimum standards for dental care and treatment to make sure that those patients that are attending a dental practice are in a safe and well looked after environment. And I say, we've got medical emergencies, we've got specific guidance from the Resuscitation Council. This is the equipment that is kept in practices. Defibrillators, they have got things for anaphylaxis, and all these things have to be kept updated. So they have a cost involved in purchasing and then actually updating them. And I mean, they may never be used. That's the best way of having drugs in dental practice, that they're not used, but they still have to then be replaced. And that again all adds up. So you can maybe start to see where some of these overheads get stacked quite high in relation to dental care. Decontamination in dental practice is driven by a document called HTM 105. And again, that tells you literally everything from, what rings you can have in your hand to how you wash your hands to cleaning down surfaces to sterilizing instruments. Yeah, it has the laws, it has HTM 105, not well, it's a bedtime read if you want to go to sleep, but some of it's actually really quite interesting, but I probably shouldn't admit to that, should I? It's probably not a healthy thing to admit to at all. So anyway, let's move on. Now, what prompted this when the 75th anniversary popped up was partly this post. Now, this was a tweet from ex-dentist Gone Bad, who is a retired dentist, who wanted to clarify the situation after Rishi Sunak suggested that therapists help reform NHS dentistry. But he didn't actually define what therapist he was talking about. And I think that the screeds of this, and I got caught up on that one stage, you know, that did these therapists rub teeth, you know, like physiotherapists, or did they bend teeth? Yeah, it all got a bit silly in some cases. But the ex-dentist, Don Bombard, decided he was going to be clear about it. Speaking of dental therapists, they're highly trained dental professionals who can carry out many treatments that dentists can to the same standard, in some cases better. And this is where government is looking towards increasing the number of dental therapists to actually work in general dental practice and actually take up a lot of that routine general dental care provision. So dentists can carry on with the stuff, the all singing, all dance and stuff that only they can do. But an awful lot of routine dentistry can be actually carried out by a dental therapist. And I'm gonna come back to that, so bear with me, because we're gonna look at the team. So let's look at those registered to clinically support your oral health zone. Okay, dentists now. This is currently in the scope of practice. The General Dental Council are currently in the process of updating the scope of practice, but I've just stuck to what is already there, mainly just so somebody doesn't come and give me a hard time, because sometimes people do get a bit antsy. Well, you said late, and I'm going, yeah, so I'm saying back to the same old thing. I don't have an original thought, somebody else has gone and done the work. Usually the first point of contact, the first clinical point of contact for most people will be the dentist. Okay, not always, but you know, you think of your general dental practitioner like your doctor, who's your general medical practitioner. They know a huge amount, not necessarily specialists in any area, but they basically are good, what I like to think of, good family dentists. They assess your mouth, they work out what you need, they advise you on how to prevent it happening again, but they can do a little bit of just about everything. If it's more complicated, you might find yourself referred on to somebody who is more trained or more extensive training or interest in that specific field. Becoming a dentist involves at least 5 years studying at a dental school, usually followed by 1 or 2 years supervised practice, and that foundation training is done in a variety of environments, and actually often where dentists decide where do they want to be. And again, that is another area that is constantly evolving: lengths of training, how they're trained, where they're trained. But only dentists and certain prescribed dental care professionals can carry out the actual business of dentistry. Now, the definition of the business of dentistry includes actually taking payment for services in the course of the practice of dentistry. They may own the practice, so your dentist may own the practice. You go to your dental hygienist may own the practice. You go to your dental therapist may own the dental. Sometimes dental nurses own it, but various people can own a dental practice, including corporates. But those sort of individuals or entities have to fulfill certain criteria to own a dental practice. So they have to, they have to prove that they actually fulfill certain regulations and guidelines which are set out by the General Dental Council and the National Health Service. And theoretically, anybody who actually meets those criteria can own a dental practice in the UK, as long as they then ensure that they practice in compliance with all the applicable laws and regulations. But so you may find now that you are a dental practice that was one dentist, one hygienist, or one dentist, one dental nurse, one receptionist, has then been bought over by a corporate, and there's plenty of those around now. So Denplan, Bupa, Portmill, that was a Freudian slip. Portman, there's lots of different corporates now there, and there's more and more of them, and then those will be managed more centrally. The day-to-day running is sort of individually, but then there'll be sort of like human resources and things, umbrellas over there. Yeah, it can get quite complicated at times, but that is becoming more popular because owning and running a dental practice is extremely expensive. Buying the equipment, buying instruments, replenishing stock, nothing comes cheap. And then actually making sure your regulations, you've got everything running the way it should be, at the standard it should be, and that all has to be monitored and maintained. It gets very, very costly. Dentists may well decide that they want to do something more involved, so they can let us try again. Very strange. Now then, I will be right back. Hopefully I will be right back, because I don't know what's quite happened there. I'm going to try again and see if I can get this. Hopefully I have returned. Who knows? You might have got rid of me. We live in hope. Right, let me see if I can get this back on. Let's see. Now, hopefully I'm back. Oh, right. Where were we? Dentist and specialist training. Yes, dentist and specialist training. They might go on to do a lot of other things. So I think I've got as far as the endodontics. No, I haven't. I've got past them. The oral medicine guys, again, if you've got a sore tongue, if you've got clenching or grinding your teeth, they tend to be the people you'll see there. Oral surgery, well, if you have a wisdom tooth that is they're struggling to get out, that's where that's going to pop up. Your wisdom tooth, the oral surgery guys. That's orthodontics. A lot of people are familiar with orthodontics these days because they shuffle teeth. I always say, I can say that because there's so many of them around my family. Pediatric dentistry obviously specializes with children's dentistry, and in my mind we don't have enough of those. But again, I'm slightly biased on that one. Periodontics are the gum guys, they're the gum gardeners. So again, specialists, you may find them in general dental practice, often they'll be in a specialist practice or a hospital setting. Prosthodontists, those are the ones who are all about tooth replacement. So again, though often in hospital, can I think of anybody that has a purely prosthodontic practice? I think there might be a few in England. Not familiar with any here. Restorative dentistry specialists and restorative dentistry basically cover the whole gamut of basically repairing teeth, is the simplest way of putting that. And special care dentistry are those practitioners who deal with those people who have special challenges that need a little bit extra care, and that can be physical, it can be mental, it can be life limiting, all sorts of things, but they are again another exceptional. The specialist training is very intense, it's hard work, and they do wonderful stuff. Your general dentists may look at additional skills that they can add on to, which they can develop over time. So they might get an interest in implants and go and do some training in implants, or non-surgical. How General Dental Council describe it as non-surgical cosmetic injectable. So basically you're talking facial aesthetics. So your Botox, your dermal fillers, things like that. And when you think about it, if you're going down that pathway, wouldn't you like somebody who knows head and neck anatomy brilliantly, and also is really used to sticking a needle in people? So, you know, I often think if you're going to go down that pathway, you know, dentists are right up there if that's what you're looking for. Maybe being slightly facetious. So that's your dentist. Now, these are the nuggets of the profession. These are the people that nobody else will work without. Anybody who is working in clinical dentistry, putting their hands in a patient's mouth, and believe me, every patient also wants to have dental nurse on hand, are dental nurses. They are a priceless commodity, which are so often ignored. And I think we really should recognize them an awful lot more, because they do a heck of a lot more than people realize. And it's not just somebody that's trying to stop you from drowning and sucking the saliva out of your mouth or mixing your filling material. These people are incredibly well trained. They think incredibly quickly. They're very agile, both mentally and physically, and they make sure everything in a clinical environment goes smoothly. They prepare the environment. Now, when I'm saying they prepare the dental surgery, you're talking about they go in, they turn on equipment, not just a matter of turning on equipment, they need to run through water lines to make sure that the water is coming to cool hand pieces that is actually sterile, so it's going into the mouth the way it should be, that the equipment is all functionally correctly, that they've got computers turned on, that they've got the right charts and the right notes for the right patients, they've got the right amount of time for patients to come in, they've got lab work if something's coming back from the laboratory. They record all the charting, so the dentist or dental hygiene therapist, the clinician is maybe calling out these numbers. So, you know, the right 6, 5, 4, 3, 2, 1, 1, 2, 3, 4, 5, 6, DO, 7, MO, all that stuff. Your dental nurse is the one that writes that. They will also probably be recording the notes, which are then checked by the clinician to further accuracy, but they sort of note all these things down as your care is ongoing. They know all about materials way more than many of the rest of us do. They will mix them. They will know the amounts for certain techniques, certain care that's being provided. They provide chairside support. They hold your hand if you need it. They will make sure everything is running smoothly. They process dental x-rays. They support patients. They can give advice, you know, so when you've had a tooth extracted, the dentist might say to the nurse, right, will you just make sure that they've got the follow-up notes or whatever else they need. And often they go on from being a dental nurse to other things. So what you can find is dental nurses priceless, get an itch and they want to actually add on additional skills. And this is only ever going to expand. So if you think about nurses now becoming nurse practitioners, I think we're going to see more and more about dental nurses evolving. And let's say they just make everybody else's life a little bit better for both clinicians and the patient. Usually their training is somewhere between 12, 24 months. It depends, different routes, they do it different ways. And they are professionals who provide clinical and other support to registrants and patients. I say lots of things that they can do, but they can then add on to that and develop their skills. And these often require them to spend money and invest in their future. Sometimes the practice will do that. But they might decide that they want to go down the route of oral health education, oral health promotion, and they're brilliant at it. They might want to be able to work with patients under conscious sedation. Now, that is a really technical course of study for them to do. They're really, I mean, they know all about the nitrous oxide and oxygen imbalances, and there are all these stuff that you just don't think that they actually need to know. But they do need to know. So these courses are quite tough going. They may look at furthering their treatment, managing patients with special needs or orthodontic patients. They can do intra and extraoral photography. And I know some dental nurses who are really excellent at that intra and extraoral photography, and they do maybe scanning if they're using scans instead of impressions. They can pour, cast and trim study models, which again, really useful in certain types of practice. They can help take shades. And I know dentists who will often get the nurse to help with the shade because they feel that they've got a better eye for matching. They can trace Kepler graphs, which again, another different type of part of treatment plans. Then what they can do is add on skills that they can work under the direction of a prescription of another registrant. Now that means taking radiographs. So a dentist may decide that they need x-rays taken, and the dental nurse has got a radiography exam and can do that. Place rubber down. So that's the rubber thing that goes over your mouth if maybe you're having filling or treatment. and there's a real knack in that. Measuring, recording plaque indices. So from a gum point of view, you want to know where the plaque biofilm is. You want to know whether your plaque scores are reducing, because that's the aim of the game. Remove sutures after wounds has been checked. You know, they've got all these things that they can do. One of the most probably one of the biggest changes you'll see, and it's happening quite a lot across England, are dental nurses who have been trained to apply fluoride varnish or on prescription from a dentist or as part of a dental health program. So some of you will have heard me talk about Child Smile. So Child Smile is a dental program, a dental oral health program in Scotland, and I mean there's variations of it across the UK, but they use their dental nurses incredibly effectively at fluoride varnish applications, and they go out to schools and they do them in the school environment, and it's brilliant. And what we know is that it makes a real difference to the long-term oral health of those children. So dental nurses can do a lot of stuff that you maybe didn't think that they did. You thought they maybe just took the water out of your mouth. So there's a lot more to it than necessarily meets the eye. What have I got here? Right. Oh, hygienists, dental hygienists. Now, dental hygienists have been around a long time. Dental hygienists, if I remember my history on hygienists correctly, evolved during the war from trench mouth, and in the USA, they needed somebody who actually would help improve oral hygiene, and they were basically created as oral hygienists for improving oral hygiene. And anyway, they've come a very long way since then, but they can provide care to adults and children, and they can carry out examinations, they take histories. Probably the thing that hygienists are known most for is for removing calcified deposits from your teeth. So removing tartar. So you may call it a scale and polish. The scale and polish term has now been shot. The scale and polish is no longer. So you're all going, what on earth are you talking about? A scale and polish really means nothing. What does it mean to me? You scale something, you polish. That is not what they're doing. They are providing professional mechanical plaque removal. So in other words, they are professional and they're mechanically removing those calcified deposits, and defines exactly what it says in the tin. So the old talk about going for an S&P or scale and polish, they are so much more than that. They will assess your periodontal health. So they assess the foundations of your mouth, because your periodontium is what keeps your teeth in there. You know, your periodontium is the bone, the fibers, the gum tissue that holds your teeth in your jaw. That's your periodontium. And basically your hygienists are the monitors and maintainers of your gum health, amongst other things. That's not the only string they have to their bow. They can do treatment under local anesthetic. They can apply various topical treatments, including fissure sealants, which is where you put a little plastic coating on the biting surfaces of teeth, most commonly to protect them and make them more self-cleansing, which in turn helps prevent tooth decay developing. They can give smoking cessation advice. They can take x-rays. They can give certain types of, certain types of injections. They can put temporary dressings and re-cement crowns with temporary cement. They can put rubber dam in. They can take impressions. They can care for dental implants and manage peri-implant disease, which sadly is becoming more common. So when an implant is becoming inflamed, your hygienist is the person that you want to make sure has a look at that. So they can recognize anatomical features and any risk of mouth cancer. So they'll be quite capable of doing a mouth cancer check, mouth cancer screening. They can refer to other professionals, and that doesn't mean dental professionals. They can meet any other healthcare professionals. So if they see and also that doesn't look right, that they are worried that they need a biopsy for, they can refer that patient to oral medicine or the appropriate person to do all of that. So they can do a lot of stuff. So they can develop other skills on top of that, because that's sort of their basic training. They might get involved in tooth whitening, which needs to be done on prescription of the dentist. Likewise, inhalation, sedation, so that's your RI, so that's your gas and air type thing, and removing sutures is another one. What they don't do, which a therapist does, what I'm going to come on to, is they don't restore teeth. So in other words, they don't do fillings, they don't do pulp treatments, and they don't adjust teeth. So if you've got for unrestored, it's get complicated because it's a filling there, they might be able to smooth it off. They don't extract teeth. I don't want to get in a whole can of worms there at the minute, but just to give you the basics of that. So dental therapists, these are the ones that Rishi Sunak has earmarked to actually pick up the slack where the NHS dental care provision is. Again, these people have been around a long time. And like hygienists, often their training is combined now. So you tend to have that they do a BSc, so a degree level program in oral health science, and they register. They can then register as a dental hygienist and as a dental therapist. Rather, in years gone by, they would have had to do 2 separate courses. So these are degree level team members, as are hygienists. And so often now, this combined dental therapist and hygienist may well have a primary qualification before that. So they might have had a primary degree, they may have come from a dental nurse background or from a dental technician's background. So, pardon me, there's lots of different ways that they will be that dental therapist. But dental therapists are registered professionals that carry out certain items of dental treatment directly to a patient or under prescription from a dentist. Now, in 2013, I'm going to come back to direct access in 1 minute. The General Dental Council removed its barrier to direct access for some dental care professionals. So you can actually now go and see a dental therapist and dental hygienist who can use their whole scope of practice without first seeing the dentist. Dental therapists, originally, way back in the 1960s, when they evolved, when they suddenly popped onto the screen, were actually created to help with the backload of NHS dentistry, and children in particular. And they were all trained in one place in London. They're now trained all over the UK by and large, apart from Northern Ireland. And they provide fillings. They can do fillings on people of all ages. They can extract baby teeth, so they can extract teeth in children. They can give local anaesthetic, and they can do pretty much any sort of restoration that doesn't involve the pulp and permanent tooth. They can do certain types of pulp therapy on baby teeth. So they actually have, plus they can do everything a hygienist can do, just get that in there. So they actually are incredibly well trained. So if you want to have a hierarchy, but dentist, therapist, hygienist, as far as those clinical people are involved, and dental therapists can provide pretty much a very extensive range of general dental care. And they do it to an exceptionally high standard. Used to be a lot of women. Now it's much mixture, but again, we've got the same thing within dentistry, that we've a lot more women than we had in the past. So, you know, it's equally attractive these days. They can work in any area of dentistry, like hygienists and obviously dentists. If they want to, they can look at additional skills like hygienists can, from the tooth whitening, inhalation, sedation, and the sutures removal. Other things are reserved for orthodontic therapists, dental technicians, and clinical dental technicians. So there's certain things that are very specific to one group of individuals within the dental team. Gosh, this is long-winded. Direct access, this is just what I've just said to you there, that you know, if you don't actually have to go and see a dentist first, you can go and see a dental hygienist directly, but that not all hygienists or therapists will see people directly, because they've got to feel confident and competent in their ability to provide care. But the General Dental Council did lift the barrier for people having to always have seen a dentist first and then been referred on. The only exception to that is tooth whitening, which still has to be carried out on prescription from a dentist, and that's really important. But if you're going to go down the tooth whitening, please seek advice from dental professionals. Now, orthodontic therapists, you're only going to come in contact really if you've orthodontic treatment, but again, they are absolute gems within an orthodontic practice. I have seen one orthodontist with 4, 5, or 6 orthodontic therapists working alongside, and they provide a lot of that basic orthodontic care. So they can remove fixed appliances and adhesives and cement. They can serve in certain types of orthodontic appliances. They can prepare the patient for treatment. Yeah, they can do an awful lot. They can fit tooth separators, so which actually allows bands to be orthodontic brackets and bands to be placed on teeth. They can carry out an orthodontic treatment need screening, which is really, really useful. They can fit bonded retainers. So some of this, unless you're having orthodontics, will all be a bit gobbledygook. But, they can take x-rays, they can prepare and remove arch wires, which have been prescribed or necessarily activated by a dentist. So there's lots and lots of stuff orthodontic therapists can do. And they're a relatively small, relatively new group within the General Dental Council's registration. But again, it's an expansion of the team. It's knowing how these people are utilised within dental care settings and how you might come into contact with them. It's a 1-year course. When they go to train, they have to be in employment as a dental nurse, dental therapist, hygienist, or technician, and we're actually on the GDC register before they do this as a post-qualification, 1-year full-time post-qualification course. So yeah, and it's intense. But as I say, these are very nimble-fingered individuals. I have watched them work, and my brain's got a bit scrambled at the speed that they can twist wires and bend things, and all very exciting stuff. Dental technicians, you've never come across. Dental technicians are, again, people that work in the background. They're in the laboratory. Some dental practice will have a technician on site. My father had a technician in the practice that we used to torture dreadfully as we were children, because he had all sorts of interesting things that we wanted to play with. But dental technicians are registered professionals, and they make the devices for your mouth from the prescription of the dentist. So they will do your crown, make your crown. They will make your implant. They will make your dentures. They are really, really skilled. They've got amazing fine motor skills. They've got a tremendous eye for detail. And where dental team members are working in the mouth will maybe work with magnification at sort of 2, maybe 3, even 4 times life size, these folk will work with loops magnification of maybe 8 times. I mean, they like to see the whole thing, and their skills are really, really phenomenal. But they've got to be very, very accurate, very detailed, and they've got to be able to follow the prescription of the dentist very accurately to get exactly what is right for that patient at that time. Again, some of them will work in practice, some of them work in a clinical setting. They may develop to become a clinical dental technician. They may learn to take impressions, record face bows, intellectual tracing. Again, some of this is quite technical. You only need to be in the environment to really understand it, so don't get bogged down with that. They don't provide treatment for or give advice to patients in the way that other professionals do, i.e. hygienists, therapists, and orthodontic therapists or dentists do. They're that little bit set back, generally speaking. But they don't work independently in any sort of clinic, and they work in a laboratory, and as I say, they provide a service for the dental team, and a very good quality, high quality service it is too. Clinical dental technicians, again, unless I wonder if you might have come across them. Don't know, it depends. Clinical dental technicians are registered dental professionals who provide complete dentures direct to patients and other dental devices on prescription from a dentist. They start off as qualified dental technicians, so they've got all that bit behind them as a technician, and then they go on to become clinical dental technicians. If they've got natural teeth or implants, they've got to see a dentist before they see clinical dental technicians, before they can begin treatment. But the other way, clinical dental technicians refer patients to a dentist if they need a treatment plan, or if the CDT is concerned about the patient's oral health. And it basically builds on dental technology, but they can make dentures, and they undertake certain treatments if they're, again, like all the other groups, trained, competent, and indemnified to do it. And that's where they provide complete dentures, the fit the other dental devices on a prescription from a dentist. They can take a dental history and relevant medical history. They can perform certain technical and clinical procedures related to removing or providing removable dental appliances, examinations. There's quite a lot of things that they can do. And again, they're a group that you probably have never come across. But this is what we're talking about. Dentistry is expanding, the dental team is expanding. And again, there's certain treatments that they cannot do, certain skills that they don't have, their reserved for other members of the dental team. But again, they can add on to their skill set, so to speak. So re-cementing crowns, temporary cement, oral health education, anti-snoring devices, suture removal, prescribing radiographs, implant abutments, and there's tooth whitening, lots of stuff there that they can add on. So everybody's skills are evolving within the dental team. And I think that's right and proper, because ultimately you as a patient want to know that you are getting the right care from the right person at the right time. So it is that whole team coming together to support what you're doing every single day, because that is the key. The dental team, and we've very much talked about, and I didn't mention this, I should have done, is the situation in the UK. Globally, different dental teams will look different, and they will not all have exactly the same dental team members as we have in the UK. And even within that, certain members will have a different scope of practice in different countries in the world. And even in the US, it changes from state to state. So I know hygienists that can give local anaesthetic at the one state. They can drive a mile down the road and they're not allowed to give local anaesthetic in the state next door. So I say one of those things that when dental professionals are moving globally, it's all about having appropriate qualifications and being trained to the level of skills that they want to provide and they're legally entitled to provide, and then maintaining and being up to date about it all. But something is all about a holistic approach. You cannot look at oral health just in the context of the dentist providing dental treatment or the dental team providing dental treatment to you and everything's going to be hunky-dory. We know there's so much more than that. Oral health is affected by, all the things go on inside your mouth, all the things that go on in your body. Then there's other aspects of life and your personal circumstances that actually impact that. So, your physical ability to actually look after your mouth, your knowledge, your gender to a certain extent, your education, your culture, your housing, all sorts of things that affect overall health as well as oral health. All of those actually come into play to help to impact your oral health and well-being. And again, those of you who've been here before know how much I focus and how much we focus on what you can do for yourself. And it is all about you doing your bit for your dental team then to be able to support you at appropriate intervals and make sure that you're doing everything you can, and then they will support what you're doing on a daily basis, either by repairing a tooth, removing tartar that you can't reach, cleaning areas that just are inaccessible, that actually making sure if you're grinding your teeth that you're not giving yourself headaches, all that sort of stuff. So the things that you can do are those individual behavior things that you can choose to eat a healthy diet, and not just talking only about the sugars and acids, keeping them to meal times only, avoiding them they are before bedtime. I'm also talking about plenty of fruit and veg, a lot of those little micronutrients that help build healthy connective tissues, because the things that hold your teeth in your jaw are connective tissues. You need, if you've got osteoporosis, for instance, that impacts your bone. Well, your bone's your bone. It doesn't matter whether it's in your jaw or whether it's in your knees or in your back. It's going to impact bones. So taking vitamin D, taking those things that are going to support good bone health. So as I say, drinking water, making sure you're hydrated, because when you're dehydrated, your mouth is dry. And your mouth is dry, the bacterial biofilm the bacteria multiplies more rapidly. The biofilm is more sticky and tenacious. It's harder to remove. And you will then need more frequent appointments with your hygienist or therapist or dentist to remove those calcifying deposits. You know, don't smoke, don't use tobacco products, drink alcohol in moderation. And really, really important, just to make sure that you are actually brushing your teeth thoroughly. You know, do your cleaning in between, in the morning, last thing at night, and in the morning. Use a fluoride toothpaste. Clean in between first, then brush your teeth, every surface, all teeth. Last thing at night, one other time every day. Spit out, don't rinse. The last thing that should be on your teeth before you go to sleep tonight is a bit of fluoride toothpaste. So, you know, there you go. That is my lot. I think you probably know way more about your dental team than you ever thought you needed to know. Yeah, I got a bit carried away, I think, with that today, but I was actually getting quite interested in reading some of this stuff, because we are going to see an evolution in dental teams and how dental care is provided in the next 10, 20 years. And if the NHS is going to survive for another 75 years, the government do need to look at how they are funding dentistry and who is going to be providing that care and in what environment. So I think the only thing we're going to be sure of is it will change. And you may well find yourself interacting with dental team members that you never have before. But what I want to reassure you is that they are incredibly well trained, they're well educated, and they have to keep up to date. If they're on the General Dental Council register, they've got to keep up to date, they've got to be competent, and they've got to be confident that they can provide the most appropriate care for you that you need at that time. So let me get out of this. Let me see, how do I get out of this? Sometimes I do these things and then I can't remember how to enter them. Got it. Oh yeah, there we go. But there you go. From me, I will see you next week, same time, same place. I hope the weather gets better. We've got horrendous weather. Wimbledon on earlier at one stage, and I'm like, sunshine, send it north, send it north. Please, we could do with a bit. It was lovely here last night, but it's blooming awful here tonight. Didn't actually mind standing here on a Thursday evening because it has been so miserable. But from your best brushing buddy, please don't forget to brush your teeth before you go to sleep tonight. If you haven't done your interdental cleaning, go do it now. It's better done at some time in the day than not done at all. Don't forget, every surface, all teeth, round the gum line with fluoride toothpaste. Spit the toothpaste out. Do not rinse out afterwards. And don't forget, I'm your best brushing buddy. I'm here to help you have a healthier smile for life. So until next week, next time, take care of yourself. If you've got any questions, please throw them this way. Thanks for joining me. Bye.